The heart monitor flatlined at 11:47 p.m., and every physician in the room stepped back. Not because they'd given up, because they'd already decided. Dr. Raymond Holt pulled off his gloves and reached for the clock on the wall. "Call it," he said. That was when the young nurse at the back of the room walked forward. Nobody moved to stop her at first. She was so quiet, so unremarkable, that most of them had already forgotten she was there. She leaned down close to the dying general's ear, and she whispered something. 4 words. A sequence. Something that sounded like a code. The room went completely still. "What did she just say?" Dr. Holt demanded. She didn't answer him. She was already reaching for the crash cart. If this story already has you holding your breath, follow my channel right now and stay until the very end. Hit like and drop a comment telling me what city you're watching from. I want to see exactly how far this story travels. The overnight shift at Maplecrest Veterans Medical Center started the same way it always did, with someone handing Nurse Lena Voss the wrong assignment sheet and expecting her to figure it out without complaining. She didn't complain. She never did. She took the sheet, noted the discrepancy. She'd been assigned to housekeeping support again despite holding a Level 2 trauma certification. And she walked to the supply room and started restocking saline bags. It wasn't her job. It was beneath 3 different people's job descriptions, actually. But the supply room was quiet, and Lena had learned a long time ago that quiet was something you protected when you could find it. Maplecrest sat on the edge of Harlow, Montana, a mid-sized city that hosted 2 military installations within 40 miles and a veterans population dense enough to give the hospital its federal funding and its name. The facility wasn't glamorous. The hallways smelled like industrial cleaner and old carpet. The fluorescent lights buzzed in the east wing after 10 p.m., and the staff elevator had been under maintenance for 6 weeks. But it handled real trauma, complicated cases, the kind of patients who came in with histories that filled 3 folders and conditions that required someone to actually think. Lena had been thinking through cases like that for 11 years. Nobody at Maplecrest knew that. Or rather, they knew she had some background, some experience, that she hadn't just wandered in off the street. But the details of her record were sealed. Her references were routed through a federal clearance office that didn't pick up the phone for routine HR inquiries, and Lena herself had never offered more than the minimum required on her intake paperwork. She was 34. She had brown hair she kept pulled back tight. She was not tall. She wore the standard-issue Navy scrubs and kept her badge clipped at her waist, and she moved through the hospital with a quality that most people interpreted as passivity, a kind of heads-down deference that the senior staff had come to rely on without ever examining too closely. What it actually was control. She finished the saline inventory, logged it, and checked the clock. 7:22 p.m. She had 9 hours left on shift. "Voss." The voice came from the doorway. Brisk, clipped, already annoyed. She turned. "Doctor." Raymond Holt was standing in the hall with a tablet under one arm and his reading glasses pushed up on his forehead, which meant he'd been in the middle of something when he decided to come find her, which meant whatever he was about to say was going to be half-formed and twice as certain as it deserved to be. Dr. Holt was the chief of emergency medicine at Maplecrest, 51 years old, impeccable credentials, the kind of physician whose confidence had been validated so many times over 2 decades that it had calcified into something that looked a lot like contempt. He was good. Lena knew he was genuinely good. That was the part that made it complicated. "Voss, why are you in here?" "Supply inventory was 3 weeks behind. I pulled the discrepancy report yesterday and flagged it to, 'That's not your department.'" "No," she agreed. "But if we run short on saline in a multi-trauma situation, it becomes everyone's problem." He stared at her for a moment. Not because she'd said something wrong, because she'd said something precise, and it had briefly interrupted the mental category he kept her in. "Bed 4 needs a catheter change," he said. "Do that." She did that. Bed 4 was a 60-year-old man named Mr. Paulson, a retired Army logistics sergeant who'd come in 3 days ago with a urinary tract infection that had climbed into a kidney complication. He was doing better. His color had improved, his fever was down, and he liked to talk. "You're the one who spotted the dosage thing yesterday," he said while she worked. "I just flagged it for the physician. The young doctor told me. Said you noticed the antibiotic overlap before the pharmacy did." "Standard review," Lena said. Paulson watched her. Old soldiers had a way of watching people, not staring, not intrusive, just attentive, like they were waiting to see how someone moved before they decided what to think of them. "Where'd you serve?" he asked. She glanced up. "What makes you think I served?" "Way you hold yourself when someone gives you an order you think is wrong." He smiled a little. "You do it anyway, but your hands go still first." She didn't answer for a moment. Then, "A while back. Branch?" "Army." He nodded, satisfied, and let her finish her work. Well, the shift went the way shifts at Maplecrest usually went. A slow accumulation of small emergencies, administrative bottlenecks, and the constant low-grade friction of a hospital where half the staff was overworked and the other half was territorial about it. At 9:15, an incoming trauma came through the bay. A construction accident, 2 workers, both with crush injuries. Lena was charting in the hallway when the first gurney came through, and she automatically read the injuries as the paramedics called them out. Bilateral lower extremity, suspected femoral involvement on the left, blood pressure dropping, airway currently clear, but the patient was going gray in a way that meant, "Voss?" Dr. Holt's voice, not looking at her. "You're not on this one. Go check on the discharge paperwork for beds 2 and 7. "His pressure's going to bottom out," she said, keeping her voice flat. "The femoral bleed—" "I have it, Voss." She stopped, held herself still, looked at the patient one more time. Then she went to handle discharge paperwork. She stood at the nurse's station, processing forms she could have done in her sleep, and listened to the controlled chaos behind the trauma bay doors. She heard Holt call for pressure, heard the monitor pitch change, heard someone call for a second line. It went on for 22 minutes before it stabilized. The patient lived. Holt had caught the bleed. He was good, and the situation had sorted itself. And Lena stood at the nurse's station and felt the specific exhaustion of someone who is always preparing for a disaster that someone else manages to avert at the last possible second. Afterward, during the brief lull, she went to the break room and poured coffee she didn't want, and stood at the window that looked out over the parking structure. Priya Suresh came in behind her, third-year resident, 28, perpetually slightly panicked, in the way that residents are when they're good enough to understand what they don't know yet. She poured her own coffee and stood beside Lena without saying anything for a moment. "You knew the pressure was going to drop," Priya said finally. "Holt caught it." "Yeah, but you knew before he did." She paused. "How?" Lena considered the question. "The color," she said. "And the way he was compensating. He was tensing his abdominals, trying to self-protect the injury. Classic response to a slow bleed. The body knows before the monitors do." Priya looked at her. "Where did you learn that?" "Experience." "What kind of experience?" Lena finished her coffee and put the cup in the rack. "Get some sleep when you can, Dr. Suresh. It's going to be a long night." At 10:40, a black SUV pulled into the ambulance bay. Not an ambulance. An SUV, late model, government plates, moving fast enough that the bay attendant had to step back. 2 men in civilian clothes got out first, then 2 in military utilities. No unit insignia visible, patches removed, and then they were pulling a gurney from the back of a vehicle that had been converted, clearly, to function as a transport for someone who needed to remain invisible. The patient on the gurney was male, late 60s, barrel-chested, the kind of frame that had once been powerful and was still formidable even in obvious distress. He was semi-conscious. His color was wrong, ashen at the lips, flushed high on the cheekbones, a specific combination that Lena recognized without being able to say, in that moment, why it was familiar. She was the first person in the hallway when they came through. "We need the trauma attending," one of the men in utilities said. His voice had the particular flatness of someone accustomed to being obeyed. "Now." "I'm getting him," Lena said. "What happened?" "That's not—" "I'm asking medically," she said. "How long has he been like this? What was he doing when it started? Has he been unconscious at all?" A beat. The man looked at her badge, looked at her face. Approximately 40 minutes. He was in a briefing, stood up, said he couldn't hear correctly, then his right side went weak. He's been in and out. Lena was already walking alongside the gurney, 2 fingers at the patient's wrist. Any medications? Known conditions? I can't. If he's on blood thinners and we give him the wrong treatment for what this looks like, he could die in the next 20 minutes, she said. It wasn't sharp. It was just true. Medications. Now. Another pause. Then the man rattled off a short list. Lena filed each one as he spoke. Antihypertensive, beta blocker. The neurological presentation. Right-sided weakness, sudden onset, 40 minutes. Auditory disturbance first. Not a stroke. Not typical. Something that looked like a stroke but wasn't presenting like one. And that distinction. What's his blood pressure history? She asked. He runs high. Always has. She pushed through the doors into Trauma Bay 1 and called for Dr. Holt before the gurney had stopped moving. Holt arrived in under a minute, which meant he'd already been alerted. He took one look at the men in military clothes and straightened slightly. Not intimidated, but aware. What do we have? 68-year-old male, acute neurological event, onset approximately 42 minutes ago. Right-sided weakness, auditory disturbance at onset, currently semi-conscious. Lena was already moving to the monitoring equipment. He's on metoprolol and lisinopril. BP history suggests chronic hypertension. Presentation is atypical for ischemic stroke. I think we should rule out hypertensive encephalopathy and posterior circulation involvement before we go with a standard protocol. Holt looked at her. She stopped. The sentence had already come out. She couldn't take it back. Voss, he said, with a specific kind of quiet that meant he was going to be civil about this in front of the military personnel and less civil about it later. Get his lines in and step back. She got his lines in. She stepped back. She stood at the periphery of the trauma bay and watched Holt begin his assessment, and she watched him move toward the protocol that she had just told him might be wrong. And she kept her mouth shut because she was a nurse in a room where a physician had just told her to step back. The patient's name, as it turned out, was on his ID tags. She saw them when she was setting the IV. 2 tags. Military, tucked under the collar of his shirt. She didn't read the name at first. Then her eyes went there without her permission. Cross, NT. She went still. Cross. She straightened up slowly. She looked at the face of the man on the table. Older now, the hair she remembered as dark, now gone entirely gray, the jaw heavier, the lines around his eyes deep and earned, and something landed in her chest like a stone dropped in water. She knew him, not from a briefing, not from a file, from a night in the Kunar province when there was no helicopter coming and no time, and nothing between a group of men and a very bad outcome, except one combat medic who refused to accept the math. She knew exactly who General Nathan Cross was, and she knew, looking at the monitors, at the presentation, at the specific way his body was fighting whatever was happening inside his skull, that Raymond Holt was about to make a mistake. The next 40 minutes were the most careful of her career. She didn't push. She didn't argue. She did everything she was supposed to do. Vital checks, documentation, secondary support. And she watched, and she saw the monitors tell a story that Holt was reading the wrong way. And she made her notes, and at 11:15 she approached him during a brief equipment pause. His pressures are responding inconsistently to the treatment, she said. Neutral. Not confrontational, just reporting. We're managing it, Voss. If it's posterior circulation, the protocol we're using won't address. I said we're managing it. He turned to look at her, and now the civility was thinner. You are not a physician. You are a nurse. Your job is support. And right now you are not supporting. You're second-guessing, and I need you to stop. One of the men in military utilities was watching from the doorway. His expression was unreadable. Lena looked at the monitor. The patient's oxygen saturation had dropped 2 points in the last 3 minutes. His sats are falling, she said. I see the monitor, Voss. Thank you. She stepped back. At 11:31, General Cross's blood pressure spiked in a pattern she had seen before. Not in a hospital, but in the field. In exactly the kind of situation where there was no hospital, where the only reference point was what her own eyes and hands could give her. A hypertensive crisis layered on top of a posterior circulation event, the two things feeding each other, and the current treatment was making it worse. Dr. Holt, she said, Voss, he's going to arrest. That is not your... The monitor screamed. Oh, the next 4 minutes were controlled chaos in the way that only trauma is. Everyone moving at once, voices clipped, the crash cart coming through the door, Holt calling compressions, Priya Suresh appearing from somewhere and taking her position without being asked. Lena stood outside the circle for exactly 3 seconds. Then she stepped forward, not pushing anyone aside, not announcing herself. Just moving into position at the head of the gurney where nobody had yet stationed themselves, her hands going to his airway, her body taking the angle that gave her clear access and clear sight lines to the monitors simultaneously. Airway is clear, she said, to no one in particular, because it was information and information needed to be said. Nobody told her to step back. There wasn't time. She worked. She didn't think about protocol or hierarchy or the conversation she was going to have with Holt afterward. She moved through the resuscitation with the economy of someone who had done this in conditions where dropping a piece of equipment meant it was gone, where the ground was uneven and the light was bad and the only thing that mattered was the patient in front of her. 3 minutes in, something shifted in her memory. The specific combination of presentation, the age, the history she'd been given in fragments, it connected to something she hadn't thought about in years. A code. A protocol developed for a specific kind of neurological crisis in high-value field personnel, used in classified contexts, shared among a very small number of combat medical personnel. Not a real medical code, a verbal reset, a sensory trigger designed to reach through unconsciousness to the part of a trained soldier's nervous system that was still, always, listening for extraction. She had used it twice in her life, once in the Kunar province, once somewhere else she wasn't supposed to talk about. She leaned close to General Cross's ear. The room was loud, monitors and voices and the mechanical rhythm of the crash cart charging. Nobody heard what she said. 4 words. She straightened up and looked at the monitor. 1 second, 2, 3, 4. On the 5th, the line on the cardiac monitor stuttered. Then it held. Then it beat. Not strong, not clean, but steady. Holt stared at the monitor. "He's back," someone called out, and the room shifted from emergency to stabilization. And in the middle of all of it, one of the men in military utilities had crossed the room without anyone stopping him and was standing 3 feet from Lena, looking at her with an expression that had gone from unreadable to something else entirely. "What did you just say to him?" the man asked quietly. Lena looked at him. "That's need to know," she said. The man stared at her for a long moment. His hand moved slowly to his radio without breaking eye contact, and across the trauma bay, Dr. Raymond Holt turned around to find out who had just answered his military escort with a classified protocol designation. And he looked at Lena Voss, nurse, unremarkable, quiet, someone he had dismissed 40 times in the past 4 months. And for the first time since she'd arrived at Maplecrest Veterans Medical Center, he had absolutely no idea who he was looking at. The man with the radio didn't move for a long moment. He just stood there with his hand resting on the device at his hip, looking at Lena the way people look at something they almost walked past without recognizing. That split-second recalibration, the double take that comes too late. "What's your name?" he asked. Still quiet, still controlled. "Voss. Lena Voss." "Full name." She met his eyes. "That's what's on my badge." He didn't push it, not yet. He raised the radio and turned slightly away and spoke into it in a low, clipped cadence that she couldn't fully make out over the residual noise of the trauma bay. She caught fragments, confirm, medic, say again. And then he was listening, and whatever he heard made his posture change in a way that most people in the room wouldn't have noticed. Lena noticed. She turned back to the monitor. Cross was holding. Not stable, not in any real sense of the word, but his rhythm had steadied into something the machines could track, and that was enough for right now. Priya was adjusting the drip on his secondary line, her movements careful and efficient, and Holt was standing at the foot of the gurney with his arms crossed and his jaw set in the expression of a man who had just watched something happen that he couldn't yet explain and wasn't ready to ask about. He would ask. She knew he would ask. But not here. Not in front of the soldiers, not while he still had the option of pretending he was in control of the situation. "I want a CT, Holt said. "Head and neck, full sequence. And get Neuro on the phone." "Neuro's going to be 40 minutes minimum," Priya said. "Dr. Alvarado is in surgery." "Then get whoever's on backup." Dr. Fitch is on backup. Priya stopped. He's not going to be the right call for this presentation. Holt looked at her. Excuse me? I'm just saying the presentation is atypical and Dr. Fitch tends to... Get Dr. Fitch on the phone, Dr. Suresh. Thank you. Priya's mouth closed. She reached for her phone. Lena was watching the secondary readout, the one on the portable monitor they'd brought in with the crash cart, which had a slightly faster refresh rate than the wall unit. She saw something. A small thing. The kind of thing you'd miss if you were focused on the primary display. His pressure was drifting again, slowly, but in the wrong direction. She looked at the IV bag, looked at the medication log on the chart. Did the math that she had been doing automatically for so long it didn't feel like math anymore? It just felt like reading. The same way a mechanic looks at an engine and sees a story rather than parts. The dosing was wrong. Not catastrophically wrong. Not the kind of wrong that would show up in any obvious way for the next 20 minutes. But wrong in the way that would matter very much in about half an hour, when the treatment they thought was stabilizing him would compound with the underlying pressure crisis and push him toward a second event. She stood there and turned that information over in her mind. She could say it directly to Holt and have it go the same way the last three things had gone. Or she could document it, quietly, clearly. In the chart, time-stamped, in terms that any reviewing physician would understand, so that if it went wrong, there would be a record. And if it didn't go wrong, she could live with having been silent again. Neither option felt clean, but then nothing about this situation was clean. She went to the chart. The CT came back 47 minutes later. Lena wasn't in the room when Holt reviewed it. She'd been sent to handle 2 other patients during the wait, a directive she suspected was partly logistical and partly about removing her from the general's proximity. She was changing a wound dressing on a patient in room 6 when Priya appeared in the doorway, still holding her tablet, wearing the expression of someone who has just been proven right about something and gotten no satisfaction from it. "He wants you," Priya said. "Who?" "Holt. The CT confirmed posterior circulation involvement, just like you said." A pause. "Dr. Fitch looked at it and agreed with you too, for whatever that's worth. He's on the phone with Holt now." Lena tied off the dressing and told her patient she'd be back to check on him. When she got back to Trauma Bay 1, the energy in the room had shifted. The military personnel had multiplied. There were now 6 of them that she could see, 2 stationed at the door and 4 positioned around the perimeter of the room in the specific configuration of people who are not technically security, but are absolutely security. A man in a suit had appeared from somewhere. Hospital administrator, she guessed, given the lanyard and the barely concealed panic in his eyes. The man with the radio, she'd started mentally calling him Carver because he had the look of a Carver, was standing near the monitoring station. When she came in, he tracked her movement across the room without turning his head. Holt was at the workstation with the CT images pulled up on the screen. "The imaging confirms a posterior circulation event with hypertensive component," he said, without preamble, without looking at her. "We're adjusting the treatment protocol." She waited. "Your earlier observations about the dosing." He still wasn't looking at her. "Were you documenting those?" "Yes." "Show me." She pulled up the chart on the secondary terminal and walked him through it. The timestamps, the pressure drift she'd flagged, the calculations she'd done on the medication interaction. He read it without speaking. She could feel the particular discomfort radiating off him, the specific temperature of a man who is going through the process of being right about something he didn't want to be right about. "Going forward," he said finally, "flag observations like this to me directly." "I did," she said, "twice." His jaw tightened. "In writing, Voss. Document it and flag it to me in writing." She almost said something. She could feel the shape of it in her mouth. The precise, accurate, completely useless observation that she had flagged it verbally and been dismissed verbally, and that the problem wasn't the medium, it was the pattern. She could feel that sentence and she let it go, the way she'd been letting things go for 11 months. "Understood," she said. The adjusted protocol stabilized Cross through the early morning hours. By 2 a.m., his pressure had come down into a manageable range, and his neurological responses were improving, tracking movement with his eyes, responding to name stimulus, which wasn't consciousness but was something. The man Lena was now certain was named Carver had spent most of that time on his radio, in the corridor, in conversations she could partially hear through the glass panel beside the door. She was restocking the procedure cart near the door at 2:17 when she heard a name. Not Carver's voice, a different one, older, a slight rasp to it, the kind of voice that is given a lot of orders in loud environments, coming from Carver's radio, loud enough to carry through a lull in the corridor noise. Need confirmation on the medic. If it's who I think it is, I want her file pulled before morning. She kept her hands moving, kept her face neutral, kept restocking. Copy that, Carver said, and his eyes moved to the glass panel, and for a half second they found hers. She looked back down at the cart. At 3 a.m., she was doing chart work at the nurse's station when Carver came out of the corridor and sat down across from her. Not beside her. Across from her, deliberately, like he was settling in for a conversation. "You've been working here 11 months, he said. "That's not a question." "No." He set his hands on the counter. "Before Maplecrest, there's a gap in your employment record. 3 years. There's a gap in a lot of people's records. Not the kind that roots through a federal clearance office when HR tries to verify it." She put her pen down and looked at him directly. "What do you need from me tonight that's relevant to your patient's care?" He considered that. "We're trying to identify what protocol you used, the verbal sequence. Our medical personnel don't have a record of it being used in the last 6 years. "I imagine not," she said. "It worked." "Yes." "Which means you have field experience with it. Which means—" He stopped, recalibrated. "How long were you in?" She looked at him for a moment. He wasn't hostile. He wasn't even particularly aggressive. He was just a man doing a job, and the job right now was figuring out who she was. And he was going to figure it out regardless of whether she helped him. "Long enough," she said, and went back to her charting. The morning shift change happened at 6:30, and with it came the particular chaos of a hospital transitioning from skeleton crew to full staff with a high-profile patient in a trauma bay and 6 military personnel making everyone nervous. Lena had 4 minutes left on shift when the head nurse, Patricia Weld, arrived. Patricia Weld was the kind of person who had been doing the same job for so long that she'd started to mistake familiarity for expertise. She was not malicious, exactly. She was the specific variety of authority figure who enforces hierarchy because hierarchy is the only organizing principle she trusts, and anything that disrupts the established order, any nurse who demonstrates knowledge that exceeds her station, any pattern that doesn't fit the expected shape, registers to her as a threat. She walked in, assessed the situation, and her eyes landed on Lena standing near the trauma bay. "Voss, why are you still here?" "Shift ends at 6:30. "Then you've got 4 minutes. Don't you have a handoff to complete?" "Complete," Lena said. "Documentation is done. Chart is current through 3:15. "Who authorized your involvement in the trauma case overnight?" Lena looked at her. "Dr. Holt." Weld glanced toward the bay where Holt was currently in conversation with the suited administrator and 2 of the military personnel. "I'll follow up with him." Her voice had gone into the register that meant she intended to make the follow-up unpleasant for someone. "In the meantime, your shift is over. Go home." Lena went home. She drove back to her apartment, 14 minutes, mostly empty roads at this hour, and she sat in the parking lot for a while without getting out of the car. Her hands were on the wheel. The engine was off. Outside, Harlow, Montana was just barely getting light at the edges, the sky going from black to the specific deep blue that precedes dawn. She was thinking about his face. Cross, the lines on it, the gray at his temples. She had not seen him in 8 years. The last time had been a debrief, a conference room, fluorescent lights, a table with water glasses, and no windows. He had thanked her. He had told her that what she did in the Kunar province had been the difference. For him, for 6 other men who were alive because of the sequence of decisions she'd made in 45 minutes that felt, at the time, like a very long time to be keeping people alive with what she had available. He had used her name. He had looked at her like she was a person, which sounds like a low bar, but in the context of everything that preceded and followed that meeting was not a low bar at all. Then she had signed documents and been thanked again and left, And eventually everything she had been had gone into a sealed file. And eventually she had ended up here. She got out of the car and went inside. She didn't sleep much. Her phone rang at 11:14 a.m. Patricia Weld. Lena looked at the screen for a moment, then answered. "I need you to come in," Weld said. "My next shift isn't until—" "I'm aware. This isn't about your shift." A pause with texture to it. Something underneath, something Weld was navigating around. "Dr. Holt wants to speak with you. And there are some people here who are also asking to speak with you." "What people?" "Come in, Voss." The drive back felt different from the drive home. She wasn't sure why exactly. Nothing had changed on the road. The same streets, the same low morning traffic bleeding into midday. But something in her had shifted in the hours since she'd left. Some internal calibration that she'd spent years keeping deliberately flat had moved fractionally, and she noticed it the way you notice a tooth starting to ache. Not pain yet, just awareness. She found a different atmosphere at Maplecrest than the one she'd left. There were 2 vehicles in the lot she didn't recognize, both government plates. One of them a van with tinted windows that had the faint silhouette of antenna equipment on the roof. Inside, the hallway outside Trauma Bay 1 had 3 people in it she'd never seen before. One in civilian clothes with a federal identification lanyard, one in Army service uniform, and one who was neither of these things. Older, a woman, short hair, the posture of someone who has been making consequential decisions for decades and has learned to carry that without telegraphing it. That third one looked up when Lena came through the doors. Something in the way she looked registered. Not recognition exactly, but the particular attention of someone who had been waiting for a specific thing to arrive. Weld was at the nurse's station. "Conference room 2, she said, without making eye contact. Conference room 2 was at the end of the administrative hall, past the break room and the supply closet, and the bulletin board that still had a flyer for a holiday party from 4 months ago. It was a small room with a table that seated 8 and a window that looked at the brick exterior of the adjacent building. Holt was there. Carver was there. The woman with the short hair was there. Lena sat down. Nobody poured coffee or made introductions, which told her something about what register this conversation was going to operate in. Holt spoke first. "Last night's incident is under review." "All right," she said. "Your involvement, specifically the verbal sequence you used on General Cross, has raised questions that are above my clearance level to address." He looked uncomfortable saying that, which meant it was true, and he didn't like that it was true. "I've been asked to step back from the investigation component." "What investigation?" The woman with the short hair spoke. "That's what we're here to discuss." Her voice was measured, not warm, not cold, calibrated. "Before we do, I need to confirm your identity. For the record," she opened a thin folder. "Lena Mae Voss, 34 years old, Level 2 trauma certification, Maplecrest Veterans Medical Center, Harlow, Montana. Prior to that, 11 years of federal employment in a classification that requires top-secret clearance to access fully." She looked up. "Does that match your understanding of yourself?" "That's accurate," Lena said. "Your previous designation," the woman said carefully, "was Combat Medical Specialist, attached to Special Operations Command, multiple deployment rotations, classified. Your discharge was honorable, and your record is sealed under a DoD privacy protocol." A pause. "What you used last night on General Cross was a classified neuro-reset protocol developed for field use in special operations contexts. It's not in any civilian medical manual. It's not taught in any program that people in this hospital have access to." She set the folder down. "You used it correctly. In a hospital context. On a patient you had no prior documented relationship with." The room was very quiet. "General Cross is awake," Carver said. It was the first thing he'd said since she'd walked in. "He regained consciousness at 0840 this morning." She took that in. "He's asked to see you," the woman said. Lena looked at her. "Is that a request or a directive?" "At this point," the woman said, with something in her expression that wasn't quite a smile but was in that direction, "it's functioning as both." She stood up. Holt said her name. Voss. And she paused, hand on the back of the chair. The chart documentation you completed overnight, he said. The dosing observations, the pressure flags. He stopped. He was looking at the table, not at her. If we'd caught that sooner, we did catch it, she said. Eventually. She left him with that and followed Carver down the hall. The room they'd moved General Cross to wasn't the trauma bay anymore. It was a private room at the end of the east corridor, so she noted the two men positioned outside who were very carefully not looking like they were positioned outside. And it had been modified in small ways. The window blinds fully closed, a secondary monitor that had been brought in from somewhere and wasn't standard hospital issue. A chair near the bed that was positioned at a specific angle she associated with the way people sit when they're expecting to have a conversation with someone who might not be fully present. Cross was present. He was propped up, oxygen still running at low flow through a nasal cannula, one arm with an IV line, the other resting on the blanket. His color was better than it had been at midnight. Not good, not healthy, but the ashen, lipless look was gone, and what replaced it was more familiar, tired, the specific exhaustion of someone who has been through something their body is still processing. He saw her when she came in. He didn't say anything for a moment. He just looked at her, and in his face she could see the same recalibration she'd seen in Carver's posture the night before. The calculation of someone adjusting their picture of something they thought they understood. "Sergeant Voss," he said. His voice was rough. Not weak, just rough. "I'm not a sergeant anymore," she said. "No." He almost smiled. "I know." She sat down in the chair, not the one positioned near the bed, but the one by the window, the one that felt less like she was reporting and more like she was choosing. "You used the Mercer sequence," he said. "Yes." "Where did you learn it?" "You know where I learned it." He looked at her steadily. "I need you to say it." "Kunar Province," she said. "You coded for 90 seconds. The helicopter was 19 minutes out. I used the sequence because it was the only thing that gave the nervous system something to follow when everything else had let go." She paused. "You came back." "I came back," he said. Something in the room had changed. Not dramatically, not in any way she could have described to someone who hadn't been in enough rooms like this one. It was the feeling of two people acknowledging a thing that had existed between them for years without being named. "Who knows you're here?" he asked. "Everyone who needs to, apparently." "The hospital doesn't know your full record." "No." "Why not?" She considered the question. It was a real question, not rhetorical, not testing. He actually wanted to know. "Because I'm not here as what I was," she said. "I'm here as what I am." He looked at her for a long moment. "Last night," he said, "in the trauma bay, before you used the sequence, someone was overriding your medical observations, dismissing them." She didn't answer. "I was conscious enough to hear some of it, not all, but enough." His voice had shifted a degree or two in a direction she recognized as deliberate. "Are you treated that way consistently?" "It's a hospital," she said. "Hierarchy is—" "I'm not asking about hierarchy," he said. "I'm asking about you." She held his gaze. "I manage." He nodded slowly, the way someone nods when they're filing something rather than accepting it. "Give us the room," he said. Not loud, not directed at anyone in particular. And behind Lena the door opened and then softly closed, and she realized Carver had been standing inside this whole time. Cross looked at her without the others present, and his expression had changed to something plainer, more tired, more honest. "I put your name in a commendation 8 years ago," he said. "It went into a classified annex. You'll never see it officially. The people who made that decision, above both of our pay grades." He paused. "I've been thinking about that for a while, about whether it was right." She didn't tell him it was okay. She wasn't sure it was. "What I know," he said, "is that last night you saved my life for the second time. In a hospital where apparently no one knows what you're capable of. And I am trying to work out what that means and what I should do about it." She looked at him, older, tired, an IV in his arm and a nasal cannula, and the enormous fact of who he was and what his presence in this hospital was already setting in motion. And she felt something she hadn't let herself feel in a long time, the specific vertigo of a situation that had gotten larger than she'd calculated. Her phone buzzed in her pocket. She glanced at it. Patricia Weld. calling again, which was unusual. Weld had already spoken to her once, had sent her to this meeting, and would have no reason to call unless... She answered. Voss. Weld's voice had dropped to the register of someone speaking quietly in a space where they didn't want to be overheard. There's a situation. What kind? The administration is pulling your personnel file. Full review. Holt made a report to the medical director. He's characterizing last night as an unauthorized intervention. A pause. They're talking about suspension pending investigation. Lena stood up. They want your badge by end of day, Weld said. Across the room, General Cross was watching her face. She lowered the phone slowly. Cross hadn't looked away from her face. He had the stillness of someone who has spent years reading situations through other people's reactions, watching the small muscles around the eyes, the set of the jaw, the particular way a person breathes when something has just gone wrong. They want your badge, he said. Not a question. By end of day. He didn't move, didn't reach for the call button or the radio or any of the several mechanisms of considerable power available to a four-star general who was, technically, in a private hospital room and not in any official capacity here. He just looked at her, and something in his expression went very quiet in the way that things go quiet before they become definitive. Sit down, Sergeant, he said. I'm not a... Sit down, Lena. She sat. Tell me who made the report. Holt. And the medical director is acting on it immediately. He glanced at the clock on the wall. 11:47 in the morning, the day after the incident. Apparently. That's fast, he said. That's someone who was already looking for a reason. She hadn't quite framed it that way, but she heard it and it landed correctly. This wasn't Holt acting out of wounded ego, or not only that. Holt had filed a report that went somewhere with sufficient speed to produce a call from Patricia Weld before noon, which meant the report had been received and acted on by someone who had been prepared to receive it. She was still turning that over when the door opened. Carver came back in, and behind him was the woman with the short hair whose name Lena still didn't have. She was carrying a tablet now, and her expression had changed from calibrated to something sharper. We have a problem, the woman said. I know about the suspension, Lena said. Not that. The woman turned the tablet around. On the screen was a document, dense text, official formatting, letterhead that Lena recognized after a moment as the Maplecrest Administrative Office. The medical director has contacted the state licensing board. He's characterizing last night as an unlicensed medical intervention. They're not suspending you. They're moving to pull your nursing license. The room went quiet in a different way than it had been quiet before. Pulling her license wasn't a hospital matter. It was a state matter, which meant a process, a timeline, a formal proceeding, and in the interim, a flag on her record that would follow her anywhere she went. It was the kind of action that ended careers permanently, the kind that was very difficult to reverse even when it was wrong, because the burden of reversal landed entirely on the person whose career was ending. On what basis? Cross asked. Unauthorized administration of an unregistered protocol, the woman said. The Mercer sequence isn't in the civilian medical literature. The hospital's position is that she used an unlisted procedure without physician authorization on a critical patient. The physician in charge was treating the patient incorrectly, Lena said. The patient arrested. I intervened. I know, the woman said. I'm telling you what their position is. Cross made a sound that wasn't quite a word. He shifted against the pillows, and the movement cost him something. She could see it in the way he held himself afterward, compensating. Who is the medical director? He asked. Dr. Ellis Brandt, Lena said. He's been director for 3 years. He and Holt have worked together at 2 previous institutions. That fact settled into the room. She'd known it for months. It was the kind of thing you noticed, working in a place where the power structure was opaque and the reasons behind certain decisions never quite tracked with the official explanations. She hadn't done anything with that knowledge. It hadn't seemed relevant until this moment. Pull the complaint and the filing records, Cross said to Carver. Everything since midnight. We don't technically have authority to cheat. I know what authority we technically have. Cross's voice had gone flat. Not angry, just final. Do it. Lena left the room because staying wasn't doing anything useful, and because she needed a moment in which no one was watching her. She stood in the corridor, not near the men at the door, slightly down the hall, by the window that looked out at the parking lot. The same parking lot where she'd sat in her car 3 hours ago, watching the sky come light. Priya Suresh appeared from the stairwell door, moving fast, pulling up short when she saw Lena. "I heard," Priya said. "News travels." The nursing station is about 100 square feet, so yes, it travels. She stopped beside Lena, slightly out of breath. "This is wrong. What Holt did, it's wrong. I was there. I watched you document everything in real time. I watched you flag the pressure readings. I watched him dismiss you twice before the arrest, and then use your protocol assessment after the fact to adjust the treatment. Priya, I'm a resident. I don't have a lot of pull here, but I can make a statement that will damage your position in this program," Lena said. "Maybe. Not maybe. It will. Holt and Brandt have been in lockstep for 3 years. Any resident who makes a statement against Holt in a formal proceeding will find that residency placement recommendations suddenly go cold." She looked at her. "I'm not going to let you do that." Priya's jaw tightened. "I don't need your permission." "No, but I'm telling you the cost, and I need you to actually count it before you decide." A pause. Priya's eyes were very bright, the controlled brightness of someone who is angry and not letting it out yet. "The chart is already documented," Lena said. "My notes are time-stamped. If it goes to a formal review, the record is there. The record can be buried, amended. You know it can." "Yes," Lena said. "I know." She didn't say what she was thinking, which was that the chart was time-stamped on a system that included a server backup maintained externally. She'd checked that months ago, the way you check things when you spend enough time in environments where documented evidence is the difference between outcomes. She didn't say it because she wasn't sure what Priya would do with that information, and because some things were better held close. "There are people in that room," she said, "who are moving on this already. Let them move." "What people?" "Military," Lena said, "and not the low-end kind." Priya stared at her. "What exactly happened last night? What did you do in there?" Lena looked out at the parking lot. "I did my job," she said. What? By 1:30 in the afternoon, 3 things had happened. The first was that Dr. Ellis Brandt had submitted the formal complaint to the Montana State Board of Nursing, officially and in writing, characterized as an emergency filing warranting expedited review. This was something Lena learned from Patricia Weld, who delivered the information in person and in a tone that had shifted, not to sympathy exactly, but to the particular neutrality of someone who is watching something happen and has started to wonder if they've been on the wrong side of it. The second was that Carver had obtained, through channels he didn't explain, a copy of the internal communications between Holt and Brandt going back 18 hours, from before the formal complaint, from shortly after the incident, in which the tone was not of physicians concerned about patient safety protocol, but of 2 people deciding on a strategy. The third was that General Cross had gotten out of bed. Not far. He was in the chair when Lena came back to the room, IV pole repositioned beside him, oxygen cannula still in place. The woman with the short hair, whose name Lena had finally learned was Colonel Diane Merritt, Medical Affairs Division, Special Operations Command, was standing at the window. Carver was on his phone near the door. 2 more people had arrived while Lena was in the corridor. A man in his 40s in Army service dress, and a younger woman in civilian clothes carrying a legal-sized accordion folder. "Sit down," Merritt said. Not the same as when Cross said it, more businesslike, but not unkind. Lena sat. "We've been in contact with the DOD legal office," Merritt said. "The classification of the Mercer sequence creates a significant problem for the hospital's complaint. They're alleging you used an unregistered procedure, but the procedure's classification means it can't be disclosed in a civilian administrative proceeding, which means they can't technically prove what you used or demonstrate. It falls outside civilian practice parameters." Lena followed that. "So the complaint stalls?" "The complaint stalls on that specific basis, yes. But Brandt knows enough about procedure to refile with different characterization. Unauthorized intervention, scope of practice violation. He doesn't need to name the sequence specifically. Merritt paused. This is not going away on a technicality. Then what is it going away on? Lena asked. That, Merritt said, depends on what we do in the next few hours. Cross leaned forward slightly. He'd been quiet since she came in, letting Merritt run the briefing, but she could feel his attention the way you feel weather. The communications Carver pulled, he said. How bad are they? Bad enough, Carver said, from the door, not looking up from his phone. Holt documents his concerns about the incident at 01:30. He contacts Brandt at 02:15. Brandt's response is not a response to a safety concern. It's a response to a mutual problem. He looked up. They're talking about her specifically, by name. The framing is about managing a narrative. Can that be used? Lena asked. Not as evidence, not in the way you'd want. How it was obtained matters. Carver's expression was neutral, but it clarifies intent, and intent can be demonstrated through other means. She looked at the woman with the accordion folder. Who are you? Major Vanessa Thill, the woman said. JAG. I've been asked to advise on the civilian-military interface issues here. She opened the folder. There's a provision under the Service Members Records Act that applies to disclosed incidents involving classified medical procedures. When a civilian institution initiates proceedings against military-affiliated personnel based on actions taken under classified protocol, there's a reporting obligation to the DoD Inspector General's office. That obligation applies to Maplecrest, whether or not they know it exists. Meaning, Lena said, meaning the moment Brandt filed that complaint, he triggered an IG reporting requirement that he almost certainly didn't know about, and the IG office has significantly broader investigative authority than a state licensing board. Phil set the folder on the table. We've already filed the notification. Cross leaned back. Which means the investigation into Lena's conduct becomes part of a broader federal review. Yes, and the federal review can subpoena documents that a state board proceeding cannot. Lena was quiet for a moment. She was following the legal architecture of it, the way one action had created an opening, the way the opening was being turned into something purposeful by people who were very good at that. It was tactically elegant. It was also, she understood, going to make this situation significantly larger and more public than she had anticipated when she'd gone to bed this morning. She hadn't asked for any of this. That was the thing she kept circling around. She had not asked for any of this. She had shown up for work, done what the situation required, and now there were JAG officers in a hospital room and an IG notification on file and a 4-star general sitting in a chair with an IV in his arm, making decisions that would have consequences she couldn't fully map yet. What does this mean for the people I work with? She asked. Priya Suresh, the nurses on the overnight shift. If this becomes federal, anyone who documented accurate observations is protected, Phil said. That's not what I asked. Phil looked at her steadily. It's complicated. An IG investigation creates turbulence for everyone inside the institution. People who weren't involved will be interviewed. It's not comfortable. Then I want to know, before I agree to any of this, what the actual exposure is for people who had nothing to do with what Holt and Brandt did. The room was quiet. You're worried about protecting witnesses who helped you, Merritt said. I'm worried about the 20 people who work in this hospital and come in every morning trying to do their jobs and don't deserve to spend 6 months in a federal investigation because I knew a classified protocol. She looked at Merritt directly. Is that a concern that's being factored in? Merritt held her gaze. Something shifted in her expression. Not warmth, but something adjacent. It's being factored in now, she said. At 3:15, the situation escalated in a direction nobody in that room had anticipated. Lena was in the corridor. She'd stepped out to take the oxygen level reading from the wall unit that Merritt's equipment wasn't interfacing with correctly, a mundane task that felt almost absurd against the backdrop of everything else, when she heard it. Not the cardiac alarm. Something else. A different alarm. The overhead paging tone that Maplecrest used for mass casualty alerts, the one that meant multiple incoming trauma cases, and a request for all available clinical staff. She stopped. The announcement followed. A highway accident on Route 12, approximately 20 miles north of Harlow, involving a passenger van and 2 other vehicles. 12 confirmed injuries. Estimated arrival of first units in 9 minutes. She stood in the corridor and looked at the door to Cross's room and then at the end of the hallway where the trauma bay doors were. Her badge had not been collected yet. She walked toward the trauma bay. Weld was already there, coordinating, moving people into position with the particular efficiency of a person who knows emergencies better than she knows anything else. She saw Lena coming and stopped. "Voss?" 12 incoming, Lena said. "What's your coverage?" "Holt, Dr. Suresh, and I'm pulling from the 2nd floor." Weld's eyes were doing the calculation that emergency nurses always do. Bodies, beds, equipment, time. "We're short." "Then you're not short," Lena said. Weld looked at her, the suspension, the complaint, the badge that should have been collected hours ago and hadn't been because Weld had never quite pulled the trigger on asking for it. Something moved through the head nurse's face. Not absolution, nothing that clean, but a recognition of something she'd been refusing to look at. "Get gloves," Weld said. The first ambulance came in at 3:24. A 47-year-old woman, front passenger, blunt thoracic trauma from the impact, BP dropping on arrival, respiratory rate elevated and ineffective. She was moving air but not well, which in blunt thoracic trauma meant one of 2 things, and both of them were time-sensitive. The paramedic was calling out numbers as they moved, and Lena was already running a different calculation than the one being verbalized. "She's got diminished breath sounds on the left," Lena said to Holt, who had arrived at the bay simultaneously and was already gloved. "I see her," Holt said. "Tracheal deviation?" she asked. He looked, a half-second where she watched him check something he might have been a moment from missing. "Left shift," he said. "Possible tension." "Needle decompression, 2nd intercostal, mid-clavicular?" "Yes." He was already moving, and then, without looking at her, without any of the ceremony she might have expected, "Stay on her pressure." She stayed on her pressure. The next 4 minutes were the specific kind of intense that Lena had learned a long time ago to function inside. Not above it, not detached, but inside it, where the noise and the movement and the competing demands compressed into a narrow channel of next action, next reading, next call. The needle went in, the tension resolved, the woman's color shifted from gray to something better, and Holt called for imaging without being asked for it. The 2nd ambulance came while they were still on the 1st patient, then the 3rd. By the time the 4th arrived, the bay was at full capacity, and 2 patients were staged in the hallway, and Priya was managing 2 simultaneous cases with the kind of controlled overwhelm that good residents learn to work through whether they're ready for it or not. Lena moved between cases. She did not have an assigned patient. She had whoever needed something that someone else wasn't positioned to give in that moment. A blocked airway on the 2nd arrival, a developing compartment syndrome she caught on the 3rd by the look of the limb and the patient's specific pain response, a medication interaction she flagged on the 4th before it was administered. Nobody told her to step back. There wasn't time. At 4:40, when the immediate crisis had resolved into the slower management phase, patients stabilized, critical ones transferred, the rest being processed through imaging and assessment. Lena was at the supply station pulling restocking items when she became aware that someone had been standing near the trauma bay doors for a while. She looked up. Carver. He'd changed into civilian clothes at some point, dark pants, nondescript jacket, which meant he'd been back to wherever his team was staying, which meant he'd been gone from the hospital and had returned, which meant he'd come back for a reason. He was looking at her with the expression of someone who has received information and is deciding how to present it. "Walk with me," he said. They went to the corridor outside radiology. Empty at this hour, slightly cooler than the rest of the floor. "We have a situation," he said. "Another one." The IG notification triggered a review flag on Maplecrest federal funding compliance records. It's automatic. Any IG filing involving a federally funded medical institution kicks a secondary review process. He paused. The review pulled the last 3 years of incident documentation, adverse outcome reports, internal complaints, HR actions. She waited. "There's a pattern," he said. "Suppressed incident reports, adverse outcomes that were internally classified as routine. 3 separate clinical staff complaints that were filed, reviewed by Brandt, and closed without action. He looked at her steadily. 2 of those complaints were about Holt specifically. One was about care decisions. One was about the way he handled contradicting clinical observations from nursing staff. She didn't say anything. Neither of those complaints appear in the public record, Carver said. They were closed internally, but they exist in the server records, which the IG review now has access to. He let that sit for a moment. This is bigger than what happened to you, Lena. It was already happening before you got here. She thought about Paulson in room 4 on her first month here, telling her about the dosage flag she'd caught. She thought about the small accumulation of moments over 11 months. The patients whose cases she'd quietly adjusted trajectories on, the observations she'd logged that had been ignored until they couldn't be, the pattern of what was acceptable and what wasn't, that had solidified around her like a structure she'd learned to navigate without naming. She'd named it now. The federal government had named it. The morning shift 2 years ago, she said slowly, there was an adverse outcome in the cardiac unit. The nurse who filed the report, I heard about it from one of the long-term staff. She was gone within a month. Voluntary resignation, officially. Her name? Carver asked. I don't know it. I heard it secondhand. We'll find her. He said it with the confidence of someone who has resources attached to that statement. Lena. He paused. General Cross is requesting that you be formally reintegrated into the management of his care. Official request through hospital administration, which means Brandt has to respond to it officially. Brandt will refuse. Brandt has a 4-star general as a patient and a federal investigation that's 48 hours old and accelerating. His options for refusal are narrowing. A pause. The official request will be hand-delivered to his office in the next 30 minutes, with a JAG officer present. She looked at him. And if he still refuses? Carver almost smiled. It wasn't a warm smile. Then he refuses on the record, in writing, in front of a JAG officer during an active IG investigation, which tells us something important about his judgment. She thought about that, about the specific legal and institutional architecture being constructed around a set of actions that had started, for her, with an overnight shift and an incoming gurney and a man she recognized on a trauma table. There's something you should know, she said. He waited. When I walked into the bay tonight, the mass casualty event, I made a call on a tension pneumothorax. I flagged a potential compartment syndrome. I caught a medication interaction. She looked at him steadily. I was operating without current authorization. My badge should have been collected this morning. I know, he said. I need that to be documented accurately. Not in a way that protects me, accurately. If the IG review is looking at how this institution handles clinical incidents, it needs to include an accurate account of the fact that a nurse under suspension protocol continued to practice because the mass casualty situation created a coverage gap and the head nurse made a judgment call. Carver looked at her for a long moment. You're documenting against yourself, he said. I'm documenting what happened. Weld made a call. I made a call. Those calls were defensible, but they should be on the record as what they were, not cleaned up into something tidier. He was quiet. The people I'm watching Brandt and Holt get held accountable for, she said, suppressed accurate records. I'm not going to do the same thing in my favor. Carver took a slow breath. Understood, he said. I'll flag it to Thill. He moved to go, then stopped. One more thing, he said. The IG review found something in the HR files from 14 months ago, just before you were hired. He turned back. There was an application from a candidate with high-level trauma credentials, significant emergency medicine background, strong recommendations. The file was reviewed by Brandt's office and closed. Position filled internally. Candidate was not interviewed. She looked at him. That candidate was you, he said. You applied for the trauma unit clinical lead position. Brandt's office rejected you before you were ever seen. Then 3 months later, you were hired as a floor nurse under a separate HR track, one that didn't route through Brandt's office. He paused. He didn't know you were here. Not until last night. The corridor was very quiet. She had applied for the clinical lead position. She'd received a form rejection, She'd applied for the floor position separately because she needed to be somewhere that handled real cases, and Maplecrest was the facility that made sense. And she'd assumed the rejection was the rejection, a judgment call, someone more qualified, something she didn't need to examine closely. She'd filed it and moved on. She had not known Brandt had been the one to close it. She had not known he'd done it without looking at her file. "Why?" she asked. "We don't know yet," Carver said, "but we're going to find out." He left her standing in the radiology corridor. She stood there for a minute, maybe longer. The fluorescent light above her buzzed faintly. Same as the ones in the East Wing, same electrical issue, same hospital, same building that had put her in a floor nurse position and spent 11 months making sure she stayed there. Her phone buzzed. She looked at the screen. Unknown number. She almost didn't answer. She answered. Silence for a moment. Then a voice she didn't recognize. Female, low, careful. "Is this Lena Voss?" "Who is this?" "My name is Sandra Okafor. I used to work at Maplecrest." A pause. "I heard something is happening there with the Federal Review." Another pause. Longer. "I filed a report 2 years ago about a patient outcome, Holt's case. I filed it and then I was told it had been reviewed and there was no further action, and then I was told my position was being eliminated." Her voice was steady. Very steady, in the way that means a person has rehearsed this call many times before making it. "I kept copies." Lena closed her eyes for 1 second. "Miss Okafor," she said, "don't talk to anyone else before you talk to a JAG officer named Major Thill. I'm going to give you a number." "Okay," Okafor said. "Okay." Lena recited the number from memory. After she hung up, she stood for another moment in the buzzing corridor. Then she walked back toward the trauma bay because there were still patients and there was still work, and whatever was happening in the administrative layer of this building was happening whether or not she stood in a hallway thinking about it. She pushed through the doors, and Holt was standing on the other side, waiting for her, with an expression she hadn't seen on him before. Not anger, not the layered contempt she'd cataloged over 11 months. Something rawer and less controlled, the face of a man who has just been informed that the story he was telling himself about his own actions has an audience he didn't know about. "My office," he said. "I have patients," she said. "Suresh has them." His voice was tight. "Now, Voss." She looked at him for a long moment, at the set of his jaw and the slight unsteadiness behind his eyes, and the specific register of a person who has come looking for a confrontation because they don't yet understand that the confrontation they're preparing for is not the one they're actually in. "All right," she said. She followed him down the hall, and behind her, through the glass panel of Trauma Bay 1, General Cross was sitting up in his chair, watching the corridor with the focused attention of a man who has spent a career knowing when something important is about to happen. Holt's office was small and aggressively organized, the kind of space where every credential was framed and every surface was controlled, where the order of things communicated something about the man who maintained it. He closed the door behind them and didn't offer her a chair, which she noted and didn't react to. She stood near the window and waited. He didn't sit either. He stood behind his desk with his hands on the back of his chair, and she could see him working through something. Not his opening line, she thought, but the shape of what he'd intended this conversation to be, versus what he was now realizing it might become. "The IG review," he said. "What about it?" "You triggered it." She looked at him steadily. "The complaint Brandt filed triggered it. That's how the statute works." "Don't." His voice came out harder than he'd probably intended. "Don't give me the procedural answer. You knew. When you told Carver to document everything accurately, including your own breach of suspension protocol, you knew what that would pull." "I told Carver to document what happened accurately," she said. "That's all." It opened an IG review into 3 years of this hospital's records. Then apparently 3 years of this hospital's records warranted reviewing. The silence between them had weight to it. He pushed off the chair back and moved to the window on the other side of the desk, putting space between himself and the conversation. "I want you to understand something," he said. His voice had shifted, the hardness gone, something flatter underneath. "What I filed was a professional concern, about protocol, about a nurse operating outside her scope in a critical care situation. That is a legitimate concern regardless of outcome. The patient lived, she said. That is not the determining factor in whether an intervention was appropriate. No, she agreed, but it is one of the factors. She paused. Along with the fact that I flagged my concerns to you verbally, twice before the arrest, along with the fact that my dosing observations were documented in the chart with timestamps before the event, along with the fact that the CT confirmed what I said the presentation indicated. She looked at him directly. You filed a complaint characterized as a patient safety concern. The record of the night makes it look like the opposite. He was quiet for a moment, looking at her in a way he hadn't looked at her before, with the specific attention of someone who is recategorizing. You've been doing this for 11 months, he said, watching, documenting. I document because that's what good clinical practice requires. You know what I mean. She did know what he meant, and she could have corrected him. She hadn't been building a case, she'd been doing her job, and the records existed because the records were supposed to exist. Because the point of clinical documentation was exactly this, to make accurate records of what happened and why, so that outcomes could be understood and improved. She hadn't been watching him, she'd been watching the patients, but she also understood that from where he was standing, the distinction might not be visible. What do you want from me, Dr. Holt? She asked. He looked at her. Something in his face went through a sequence she couldn't entirely follow. Frustration and something older, something that had been there longer. I want to understand what I missed, he said. It came out quietly, not as an apology, not close to one, but as something honest in a way that surprised her. You were here 11 months. I looked at you every day and I saw... He stopped. What did I miss? She held his gaze for a moment. The honest answer was complicated, and she knew she wasn't going to give him the full version of it, not in this room, not today. You saw what the role said you were supposed to see, she said, and you didn't look past it. He absorbed that. He didn't agree with it yet, but he held it, and she could see him holding it. His desk phone rang. He picked it up, listened for 10 seconds. His expression changed. I'll be there, he said, and hung up. He looked at Lena. Brant wants us both in the boardroom, now. The boardroom was on the administrative floor, past Brant's office and the HR suite and the conference rooms that were used for quarterly reviews and budget presentations. Lena had been in it once for an orientation session 11 months ago that had lasted 45 minutes and told her nothing useful about the actual landscape of the institution she was joining. When they arrived, it was not the meeting she'd expected. There were 8 people in the room. Brant, at the head of the table, with the controlled expression of a man who has decided that composure is a position. 2 members of the hospital's board of directors. She recognized one of them, a woman named Harriet Slocum, from the framed board portraits in the main lobby. Major Thill, the JAG officer, seated to one side with her accordion folder. Carver, in the same civilian clothes, standing near the wall rather than seated, which was its own kind of statement. Colonel Merritt, who had somehow changed into service dress uniform since this morning. And 2 people Lena didn't recognize, a man and a woman, both in civilian business clothes, both with the posture of government and the particular blankness of people accustomed to rooms that don't go well for someone. She found out who they were when the woman introduced herself. Special Agent Clara Vance, DOD Inspector General's office, and her colleague, Special Agent Mark Ferris. They had driven from the federal building in Billings. They had been driving since Carver made a phone call that morning. Lena sat down at the table. Holt sat beside her, slightly too far away for it to look deliberate, but she noticed the distance. Brant opened. He was good at boardrooms. She could see that immediately, the way he calibrated his tone for the directors, the way he framed his opening as institutional concern rather than personal agenda. We're here to address a serious incident, he said. A clinical intervention conducted without authorization by a staff member currently under suspension review, and the subsequent triggering of a federal investigative process that is creating significant operational disruption for this institution. Subsequent triggering, Merritt said. Not loud, not aggressive, just precise. Brant looked at her. Colonel? The IG review was triggered by your complaint, Merritt said. That's the statutory mechanism. You filed against a military-affiliated individual for actions taken under classified federal protocol. The review is a direct consequence of that filing. She paused. If it's created operational disruption, the source of that disruption is the filing, not the investigation. Brandt moved past it with the smoothness of someone who has decided not to engage on that particular ground. The central issue is patient safety protocol and scope of practice. Dr. Brandt! Agent Vance's voice was quiet and landed like something flat and heavy on the table. We're not here to mediate a scope of practice dispute. The IG review has surfaced documentation that goes significantly beyond the incident that triggered the filing. I'd like to walk through that, with the board present, before we discuss any other agenda items. The room went still in the way rooms go still when someone has just shifted where the power is. Brandt looked at the two directors. Harriet Slocum was watching Vance. The other director, a man in his 60s named, per the lobby portrait, Robert Fenn, was looking at the folder in front of Vance with the expression of someone who already suspects what's in it. "Go ahead," Fenn said. "Tut." What followed was 40 minutes that Lena would think about for a long time afterward. Not because of what was revealed exactly, because she'd suspected the shape of most of it, but because of the specific experience of sitting in a room and watching a structure that had been invisible become suddenly, comprehensively visible. Vance walked through it methodically. 3 adverse outcome reports filed in the past 2 years, each reviewed internally and closed by Brandt's office without external notification, 2 of which had outcome severity that met the mandatory reporting threshold to the state health department. 2 internal complaints about Holt's clinical decision-making, one from a scrub tech, one from a second-year resident who had since left the program. Both closed without action. A pattern of HR dispositions for staff members who had filed or attempted to file formal complaints, the outcomes of which, voluntary resignations, position eliminations, non-renewals, clustered in a statistically notable way around the 6-week window following complaint submission. Sandra Okafor's case was in there. Cardiac unit, 18 months ago. Adverse outcome. Complaint filed. Position eliminated. There were 2 others. The room didn't react dramatically to any of this. That was the thing about institutional accountability that Lena had learned in a different context, in a different kind of room, a long time ago. It didn't look like a movie. It looked like people sitting at a table getting information that made them very quiet. Holt was very quiet. She looked at him once, midway through Vance's presentation. He was staring at this table surface, and his hands were flat in front of him, and he had the specific stillness of someone experiencing the moment when the story they've been telling themselves meets a version of events that doesn't accommodate them. He hadn't known about the Okafor case. She was almost certain of it. He hadn't known about the other complaints either. That didn't absolve him of anything. He had been the subject of those complaints, and his behavior had been the behavior that generated them, and there was no version of that which wasn't his. But Brandt had suppressed records that Holt hadn't known were being suppressed, which meant that some portion of what Holt understood about his own history in this institution was based on a fiction that Brandt had maintained for reasons that were not entirely about protecting Holt. She was still thinking about what those reasons might be when Fenn spoke. "Dr. Brandt," he said carefully, "were you aware of these reports at the time they were closed? The internal review process." "That's not what I asked." Brandt paused. 1 second, 2. In those 2 seconds, Lena watched him make a decision, not about the truth, about which version of the truth was survivable. "I was aware of the filings," he said. "The review process concluded there was insufficient basis for external reporting." "Under what criteria?" Phil asked. "Our internal compliance framework." "Which was developed and approved by whom?" Another pause. Shorter. "My office, in consultation with legal counsel." Phil made a note. The sound of the pen on paper was the loudest thing in the room for a moment. "I'd like to see the compliance framework documentation," Vance said, "and the legal counsel correspondence. I'll need to consult with—" "That's a formal IG request, Dr. Brandt," Vance said. "The timeline for compliance is 48 hours. Brandt looked at the 2 directors. Neither of them looked back at him. Harriet Slocum was writing something on the notepad in front of her, and her expression had moved from neutral to closed in a way that communicated without words that a door had swung shut somewhere. The meeting ended without resolution, because these things don't end in meetings. They continue outward, into processes and timelines and legal frameworks that grind forward with the indifference of machinery. People left the boardroom in small groups. Brant left last, with the unhurried gait of a man who is deciding what to do next, and Lena noted that he didn't look at her on his way out. She stayed until the room had mostly cleared, then walked to the elevator with Merritt. "What happens now?" she asked. "IG completes the review. 30 to 60 days, realistically." Merritt pressed the elevator button. "The state board complaint will likely be withdrawn pending IG findings. Phil has already filed for a stay. And the license situation? Protected for now. The stay prevents any action until the federal review concludes." Merritt glanced at her. "Your documentation was good. The timestamps, the chart notes. It's a clear record. Any review board is going to see that." The elevator came. They got in. "Holt," Lena said. Merritt looked at her. "He didn't know about Okafor," Lena said. "No, probably not. That doesn't change what he did to me, or to other staff." "No," Merritt said, "it doesn't. But it changes the shape of it. Brant was managing him, using the suppressed records as, I don't know, insurance, control." She was thinking out loud, not asking for confirmation. If Holt had known there were 2 formal complaints about him in the file, he might have changed his behavior, or left. Brant kept him in the dark and kept him in place. The elevator reached the clinical floor. Merritt held the door. "That's a perceptive read," she said. "What was Brant getting out of it? We don't know yet. That's part of what the review will establish." She let the door go. "Get some rest, Lena. You've been awake for—" She checked her watch. "Approximately 31 hours. Lena hadn't counted. She did the count now and found it correct. She went back to Cross's room. Damn. He was awake. He'd moved from the chair back to the bed, which probably meant the pain levels had shifted in a direction he wasn't going to mention, because he was the kind of person who had learned to relocate rather than complain. The secondary monitor was showing his vitals. Better, steadily better, though she noted his pressure was still running slightly high, and filed it. "How'd it go?" he asked. She sat down in the chair, the one by the window, same as before. "Brant is in trouble." "Good. It's not clean. These things aren't." "I know they aren't." He looked at her. "How are you?" She considered the question, which she had not been asked once in the past 20 hours. "Tired," she said. "Uncertain about some things." "Fine." "What are you uncertain about?" She looked at the window, the blinds still closed, the thin line of afternoon light coming through the gap at the bottom. "Whether this was the right sequence of events, whether what's happening to Brant and Holt is, whether the mechanism is right, even if the outcome is." He was quiet for a moment. "You think the IG review might be disproportionate?" "I think it was the tool that was available and it was used, and it will probably produce the right outcome. And I'm still not entirely comfortable with the part of it that came from your people being here rather than from normal institutional process." She paused. "Normal institutional process failed. I know that. But it would be easy to call this justice when part of what it is just leverage." Cross looked at her for a long time. "When I was in the Kunar province," he said, "and you kept me alive, you made about 15 decisions in 45 minutes that didn't have a clean option. Every one of them was a choice between bad and worse." He paused. "That's not the same as choosing wrong." She didn't answer, but she held the thought. "Lena," his voice had shifted, "there's something you should know about why your name was in my file." She looked at him. "When I put in the commendation 8 years ago, it went into a sealed annex, but I also wrote a supplemental note, personal record, not official, just what I thought should be remembered." He paused. "I wrote that if anything ever happened to me in a clinical context and she was anywhere near the situation, anyone attending to me should listen to her, without qualification, unconditionally." She stared at him. "The men who came in with me last night, Carver and the others, they'd read that note. It's part of my medical escort file." He held her gaze. "They were never going to remove you from that trauma bay. Not once they understood who you were. She absorbed that. You couldn't have known I'd be here. No, I didn't know. He almost smiled. But I wrote the note because the world is smaller than it looks, and people who are worth listening to tend to end up in rooms where they're not being listened to. I wanted to make sure that if I was in one of those rooms, someone would remember. She didn't know what to say to that. She sat with it. Her phone buzzed. Priya, you need to come to the nursing station, now. She stood up, cross-watched her face. Go, he said. Priya was at the station with 2 other nurses, Keisha Martin, who'd been at Maplecrest 12 years and seen everything, and a younger one named Dario, who was 3 months in and still in the phase of not entirely believing the things he witnessed. All 3 of them were looking at a document on the station monitor. Lena came around the counter. The document was an internal memo, time-stamped 40 minutes ago, distributed from the medical director's office to department heads and senior nursing staff. She read the first paragraph, and then the second, and then she stopped and read the second again. The memo announced an immediate clinical restructuring. Effective the following Monday, all nursing staff observations classified as diagnostic in nature. Pressure readings, medication interaction flags, symptom assessments beyond the scope of assigned monitoring were to be routed through a physician intermediary before being logged in the patient chart. Nurses were not to enter diagnostic observations into the primary chart directly. A secondary logging system would be implemented for nursing observations, which would be reviewed by a supervising physician before integration into the medical record. She stood there and read it twice more. He did this today, Priya said, and her voice was doing the very controlled thing it did when she was genuinely angry. After the boardroom meeting, after the IG presentation. He knew the timestamps were the problem, Keisha said. Lena's chart notes, the fact that they were direct entries timestamped before the event, that's what made the documentation clean. He's trying to create a system where nursing observations have to pass through a physician before they go on the record. Well, Lena understood the mechanics of it immediately. A secondary logging system meant a delay. A delay meant timestamps that reflected physician review, not original observation. And physician review meant that an observation flagged at, say, 11:15 and dismissed at 11:16 would not appear in the chart at 11:15. It would appear when the physician decided to integrate it, if they decided to integrate it at all. The record would show physician decisions, not the sequence that preceded them. It was, structurally, a system designed to erase the kind of evidence that had just spent 40 minutes being presented in a boardroom to a federal investigator. He can implement this? Dario asked. He looked genuinely confused, which made sense because he was 3 months in and hadn't yet learned the full geography of what administrators could do. He can try, Keisha said. Lena looked at the timestamp on the memo. Then she took out her phone and called Thil. Thil answered on the second ring. There's a memo, Lena said, from Brant's office, distributed 40 minutes ago. I'm going to photograph it and send it to you. She paused. It restructures the nursing documentation system in a way that would eliminate direct time-stamped entry of clinical observations. A beat of silence on the other end. Send it now, Thil said. Lena photographed the screen, sent the image, waited. Is this time stamped on the distribution system? Thil asked. Yes, 43 minutes ago. Another pause. Longer. When Thil spoke again, her voice had something in it that wasn't satisfaction exactly, but was in that direction. He issued this during an active IG investigation, she said, in a manner that could constitute obstruction of the review process. A pause. Don't let anyone implement that system. I'm calling Vance. She hung up. Priya was looking at Lena. What do we do? She asked. Nothing, Lena said. Document the memo's existence in the nursing log. Standard internal communications record. Time, content summary, distribution list. Then we wait. What are we waiting for? Lena looked at the timestamp on the screen. About 20 minutes, she said. It was 18. A facility security officer came through the administrative corridor door at 4:53 and went directly to the wing where Brant's office was. He was followed by Agent Vance and Agent Ferris, moving with the specific purpose of people who have authorization and are not in a hurry because they don't need to be. Lena was at the nurse's station. She did not go to watch. She had paperwork from the mass casualty event that still needed completion, and she sat down and worked through it methodically, form by form, the documentation of what had happened and why and in what order. The record that would tell whoever read it later exactly what the evening had looked like and what each person had done. At 5:20, Patricia Weld came down the hall from the administrative wing and stood at the nursing station with the particular expression of a person who has just seen something reconfigure their understanding of where they are. "Brandt is being escorted from his office," she said. Nobody said anything for a moment. "Security escort?" Keisha asked. "Federal," Weld said. Lena kept writing. Weld stood at the edge of the station and looked at her. At the bent head, the pen moving, the precise and unremarkable posture of a nurse doing paperwork after a long shift. "Voss," she said. Lena looked up. Weld opened her mouth, closed it. The thing she wanted to say was complicated. Lena could see that. It was the shape of an apology that had to account for 11 months and a lot of small moments that didn't look like much individually, but made a pattern. And Patricia Weld was trying to find language for that pattern, and discovering it didn't come easily. "I'll have the personnel file corrected," Weld said finally. "The suspension notation. I'll flag it for removal first thing tomorrow." "Thank you," Lena said. Weld nodded, started to go, then stopped. "The position you applied for," she said, 14 months ago, the clinical lead." She was looking at the wall, not at Lena. "We're going to have an opening, soon probably." She paused. "I'll make sure the application goes through the right process this time." She left before Lena could respond. Lena sat with that for a moment. Then she went back to her paperwork. At 6:40, Holt found her in the break room. She was eating something from the vending machine. Crackers. Not because she wanted crackers, but because it was the only thing she could get in 90 seconds, and she'd been moving too fast for too long, and her body had started sending signals she couldn't defer anymore. She was standing at the counter because sitting down felt like a commitment she couldn't make yet. Holt came in and poured coffee. He stood at the other counter across the small room. They were there for a minute without either of them speaking. "I didn't know about the complaints," he said. "I know," she said. "That doesn't—" "I know," she said again, not cutting him off, just acknowledging that she'd already been through this version of the conversation in her own head, and the conclusion was the same. "It doesn't change what the behavior was, but it changes some of what I understand about why the behavior was allowed to continue." He drank his coffee, set the cup down. "I've been thinking," he said, "about the night of the trauma, before Cross arrested. You came to me twice." He paused. "The first time I was irritated. I thought you were overstepping. The second time—" He stopped. "The second time I heard you, I just didn't act on it," she said. "Act on it," he agreed. He said it quietly, and it landed like a thing he'd been not saying for 18 hours. She finished her crackers, folded the wrapper. "I need to sleep," she said. "I've been awake for 32 hours and I have patients and I need to sleep." "Go," he said. She was at the door when he spoke again. "Voss." She stopped. "What you did last night, all of it. The sequence on Cross. The mass casualty response, the documentation." He paused. "I don't know what the right word is." "Professional," she said, and left. She walked down the hall toward Cross's room to check his evening vitals before she handed off. Through the glass panel of the trauma bay, she could see it had been reset for the next shift. Clean, prepared, the equipment back in its positions, ready for whatever came through the door next. She stopped walking. At the end of the administrative corridor, the elevator doors were opening, and coming out of them were two men she'd never seen. Both in service dress, both senior rank, both moving with the purposeful bearing of people who had been briefed on their way here and were arriving with decisions already made. One of them was carrying a document folder with a DoD seal visible on the cover. He looked down the corridor. He saw her. He said something to the man beside him. And the second man, who was carrying nothing, whose hands were free, who looked at her with the specific recognition of someone who has seen a photograph and is now seeing the person, reached into his jacket pocket and produced a laminated identification card that, even from 30 feet away, Lena could read the header of. Office of the Secretary of Defense. Her phone rang. Cross, calling from the room 20 feet behind her. She answered without taking her eyes off the two men. The men coming off the elevator, Cross said. Don't be alarmed. I'm not alarmed, she said. They're here for you, he said, but not the way you're thinking. The men were walking toward her now. The one with the folder had opened it, and she could see that whatever was in the document he was carrying was something he intended her to see, and the expression on both of their faces was not the expression of men arriving with bad news. It was the expression of men arriving with something overdue. The man with the folder stopped 3 feet from her and held it open. The document inside was a single page, official letterhead, dense with the specific formatting she recognized from a different chapter of her life. The chapter that had been sealed and filed and not spoken about in 11 years. She read the header. Read the first paragraph. Read the authorization signature at the bottom, which was not a signature she had expected to see on anything addressed to her ever again. She lowered the phone from her ear. Ms. Voss, the man said. His name tag read Captain D. Holloway. I've been asked to deliver this in person. The general requested we handle it that way. She took the document from the folder. It was a formal declassification notice. Partial. Not everything, not the full record. Some things would stay sealed because some things needed to stay sealed, and she understood that and had made her peace with it years ago. But enough. The Kunar Province operation, her field designation, the commendation cross had written into the classified annex, the Mercer sequence and her certified training in it, documented, dated, authenticated, and at the bottom, a 1-paragraph summary that translated 11 years of sealed federal service into language that a state licensing board, a hospital administrator, or any civilian review body could read and understand. She stood in the corridor and held the paper and felt something move through her that she didn't immediately have a name for. Not relief, exactly. Not vindication, though it was that. Something quieter and more complicated. The specific feeling of a door opening onto a room you'd stopped expecting to see again. There's a secondary document, Holloway said. He produced a second page. This is a formal correction to your employment record, countersigned by the DODHR office. It reflects your full clinical qualifications as of your date of hire at Maplecrest. He paused. The original file that Brandt's office reviewed when you applied for the clinical lead position, it was incomplete. The clearance routing meant your trauma and field medicine credentials weren't visible in the civilian HR system. She looked at the second document. He rejected me because the file looked thin, she said. Yes, Holloway said, not malice, not a targeted decision, a bureaucratic gap. Her real record locked behind clearances that a hospital director didn't have, producing a file that looked like a nurse with patchy employment history and no distinguishing credentials. He'd rejected her for a senior clinical position because the system had made her look unremarkable. And then she'd come in through a different door, under a different process, and spent 11 months being unremarkable in person. The second man, whose name tag she now read as Major P. Stein, spoke for the first time. The general would like you to come back to the room when you're ready, he said. There are some people joining him shortly. She looked down the corridor at the closed door of Cross's room, then back at the documents in her hand. Give me 5 minutes, she said. She went to the break room, empty now, the coffee Holt had poured still sitting on the counter, and she stood at the window and read both documents twice. Not because she needed to read them again, because she needed a moment in which she was not performing anything for anyone, in which she could simply be a person standing in a room with paper in her hands and 33 years of experience and a body that had been awake for too long and a mind that was finally, after 11 months, starting to let something down. She had not cried in the trauma bay. She had not cried in the boardroom or the corridor or the break room or the car in the parking lot at dawn. She was not going to cry now, in the sense that the feeling that came up was not quite that. It was more like a long exhalation, something that had been held so long it had become structural, and the letting go of it was disorienting because you'd forgotten you were holding it. She stood there for 4 minutes. Then she put the documents in her coat pocket and went back to work. The people joining Cross were not who she expected. She had expected more military, more uniforms, more formality, the kind of assembly that happens around senior officers in institutional moments. What she found in the room was smaller and more specific. Colonel Merritt, Carver, Major Thill, and Priya Suresh, who was standing near the door with her hands in her coat pockets, and her expression hovering between uncertain and determined, and Patricia Weld, standing against the far wall, arms crossed, with the posture of someone who has made a decision that cost them something. Cross was sitting up fully in the bed now, the IV still running, the cannula still in place, but the posture of a man who has reclaimed his vertical relationship with the world. His color had improved significantly from the gray of the previous night. He looked tired and deliberate and entirely present. He looked at Lena when she came in. "Good," he said. "Sit down." "I'd rather stand," she said. She wasn't being difficult. She'd been sitting in chairs in institutional rooms for 20 hours, and she needed to be on her feet for whatever this was. He accepted that. "The declassification came through. I received it. I want to make sure you understand what it does and doesn't do," he said. He was watching her carefully. "It doesn't restore your operational status. That option is available if you want it, and I can facilitate that conversation, but I'm not going to push it on you." "I don't want it," she said. "All right." He'd expected that. "What it does do is give you a complete, accurate record in the civilian system. Your credentials, your training, your certifications, all of it is now visible and documentable for any employer, any licensing board, any review process. And the Mercer sequence," Thill said, "is formally noted as a classified protocol for which you hold certified training, which resolves the scope of practice question categorically. There's nothing for the state board to act on." "The complaint has been withdrawn," Merritt said. "Formally. Brandt signed the withdrawal as part of the IG process about 20 minutes ago." She absorbed that. "Under what circumstances?" "The IG offered a cooperation framework," Merritt said. "If he cooperates fully with the documentation review, the characterization of his conduct shifts from obstruction to mismanagement. That's still career-ending, but it's the difference between a federal referral and an administrative process." She paused. He took it. Lena looked at Weld. "What happens to the hospital?" Weld unfolded her arms. "The board is convening an emergency session tomorrow. Brandt's removal is... that's already effectively done. The reporting failures on the adverse outcomes, the complaint suppression. The board can't sustain that once it's on federal record." She paused. "Robert Fenn is taking interim executive authority. He called me an hour ago." "And Holt?" The room went slightly quieter. "That's a more complicated question," Merritt said. "Yes," Lena said. "It is." She knew it was. She'd been knowing it was since the break room, since he'd stood across from her with a coffee cup and the specific face of a man trying to count what he'd done honestly for the first time. Holt had behaved badly, systematically, consistently, in ways that had real consequences for real people. He'd dismissed her and dismissed others and built a professional identity on the assumption that his judgment was automatically superior to anyone below him on the hierarchy. That was true. Also true, Brandt had been managing him, keeping records from him, maintaining a power structure that depended on Holt being exactly the kind of person he was, and curious about what was being suppressed in his name, too certain to look. Holt had done harm. Brandt had organized that harm and profited from it. They weren't the same thing. She needed them not to be the same thing because if she collapsed them into a single category, she lost the ability to think clearly about what accountability should actually look like. "There's a peer review process," she said, "for his clinical decisions. That should run through the normal channels, not the IG, not JAG. The hospital's credentialing committee." "That's appropriate," Weld said, "and the complaints that were suppressed, Okafor and the others, their files need to be restored to the official record and reviewed as if Brandt had never touched them." "Already in process," Thill said. "Then that's what I want," Lena said. "I don't want anything from outside the normal process applied to him. What he did should be answered by the system that should have answered it 18 months ago." Cross looked at her. There was something in his expression that she recognized after a moment as the particular respect of someone who has encountered a form of precision they didn't expect. "You're being more generous than most people would be," Priya said from the door. She said it carefully, not as a critique. "I'm being accurate," Lena said. "Generous and accurate aren't the same thing." The formal part of what Holloway and Stein had come to do happened 40 minutes later in the corridor outside Cross's room. It wasn't a ceremony. She'd been clear she didn't want a ceremony, and Cross had respected that. What it was a formal acknowledgement. Holloway reading a brief statement from the Secretary of Defense's office into the official record, Stein witnessing, Merritt co-signing. It took 6 minutes. It would appear in her file as a commendation with a declassified summary, actionable in any civilian or military context. The corridor was not empty when it happened. Shift change had brought people through, and people slow down when something unusual is happening, even if they don't know what it is. And so there were nurses and an orderly and 2 residents standing at a slight distance, with the expressions of people who are witnessing something they don't have full context for, but understand is significant. Priya was there. She wasn't subtle about watching. Keisha Martin had appeared from somewhere and was standing with her arms folded, and when Holloway finished reading and Lena signed the acknowledgement form, Keisha nodded once, the specific nod of someone who has watched things go wrong for long enough that watching something go right produces a very restrained and deeply felt response. After, Cross asked Holloway and Stein to give them a few minutes, and they went back to his room, and he sat on the edge of the bed and she stood by the window. See, different window now, this one looking out over a courtyard with a bench and a tree that was losing its leaves in the October cold. "There's something I want to say," he said. "You don't need to." "I know I don't need to." He said it with a slight edge that reminded her he was also not the kind of person who was talked out of things easily. "I've been thinking about the 8 years, between Kunar and now. You went into civilian medicine, which you were qualified for and more, and spent those years, what, in rooms like the ones you worked in here?" "Different hospitals," she said. "Similar rooms. Being what you've been here. Mostly. Did that feel like, was that a choice you made or something that happened to you?" She thought about it. It deserved a real answer. "Both," she said. "I needed to be somewhere that didn't know what I'd been. I needed to find out what I could do when nobody had pre-decided what that was." She paused. That part was a choice. The part where the rooms kept being the same kind of room, that felt more like gravity. "Gravity," he repeated. "You go where the work is. The work in those rooms was real. The patients were real." She looked at the courtyard. The bench had a light film of frost on it that the afternoon sun hadn't reached. "I didn't love being invisible. I want to be clear about that. But I understood what I was doing there, even when other people didn't." He was quiet for a moment. "I want to ask you something," he said, "and I want you to hear it as an actual question, not as pressure." She waited. "The clinical lead position, the one that's going to open up here. Would you want it?" She looked at him. "Or something equivalent," he said. "Somewhere. With your record corrected, with the full credentials visible, you have options that weren't accessible before." She'd been thinking about this intermittently through the afternoon, not planning, just the occasional awareness that the landscape had changed shape, and she didn't yet know what she wanted to do with that. The clinical lead position at Maplecrest would mean managing people, developing protocol, sitting in rooms like the boardroom and making decisions about how the institution ran. She could see herself doing that. She could also see clearly what it would cost. The particular loss of going from the floor, where the work was immediate and physical and specific, to the administrative layer where the work was real but more diffuse. "I don't know yet," she said, "and I think not knowing yet is the honest answer." He nodded. "Fair. I'd like to stay on the floor for a while," she said. "I'd like to finish some things I started here." "Like what?" She thought about Mr. Paulson in room 4 who had been watching her since her first week, and waiting, she thought, to figure out what he was looking at. She thought about Priya, who was good and knew she was good, and was still learning that those 2 things together were enough to build something on. She thought about Dario, 3 months in and still in the phase of not believing the things he witnessed. "Small things," she said. He smiled. It was the first full smile she'd seen from him, and it looked like the same smile from the debrief room 8 years ago. A little tired, a little surprised. Entirely real. "All right," he said. Sandra Okafor came to the hospital the following afternoon. Lena hadn't asked her to come. Phil had arranged a formal interview, which was something else, and Okafor had requested to come in person rather than via video conference, and so she arrived at 3 p.m. and was met by Phil and brought to a conference room. But on her way there, someone pointed her to the nursing station, and Lena was at the station when she came through. She was in her mid-30s, natural hair pulled back, the posture of someone who has been carrying something for a long time and hasn't yet been told it's safe to put it down. She stopped in front of the station. "Your Voss?" she asked. "Yes." Okafor looked at her for a moment. "I kept the copies because I thought someday it would matter," she said. "And then I thought maybe I was wrong, and then I kept them anyway." "I'm glad you did," Lena said. I needed to see the place again." She looked down the hallway. "I needed to see that it was still here and that something was different." "It's different," Lena said. Okafor nodded slowly. She didn't cry. She just stood there for a moment with the expression of someone letting a long-held breath out slowly, and then she straightened up and said she should go find Major Thill, and she walked down the hall. Lena watched her go. There were other names she didn't know yet, other people who had filed reports and been managed out, who had kept copies or hadn't kept copies, who had gone somewhere else and told themselves it was fine and not quite believed it. The IG review would find some of them. The corrected records would acknowledge them in the formal sense. But acknowledgement in the formal sense and the actual experience of someone saying, "I know what happened to you, and it was wrong, and you were right," those were different things, and the second one was harder to deliver through official channels. She thought about that for the rest of the shift. Cross was discharged on a Thursday, 5 days after he arrived. Not to anywhere local, a military medical facility, better equipped for the continued monitoring his condition required, the kind of place with the specific resources that weren't available in a mid-sized veterans hospital in Harlow, Montana. The discharge was quiet, early morning, the way significant departures often are, before the day gets full, before there are people in corridors watching. Lena was on shift. She came to his room at 6:40 to complete the discharge vitals. He was already dressed, which she noted, and the room had been returned to its neutral hospital state. The secondary monitor removed, the personal items packed, the chair by the window back in its standard position. She ran the final vitals, everything within acceptable range. She made the notation in the chart. "You're clear to transfer," she said. "I know." He was standing near the window, the courtyard one, the bench outside still bare and cold. "The tree's going to be interesting in the spring," he said, "when it comes back." She looked at the tree. "Probably." He turned from the window. "I've asked Merritt to send you updates on the IG proceedings, directly, not through official channels, so you know what happens." "You don't have to do that." "I know." He said it with the same slight edge as before, and she let it stand. "There will also be a request from the board, I think, once the dust settles. About the documentation policy, the nursing observation protocol. I've suggested that if they're looking for someone who understands what the system should look like, they might ask you. I'm a floor nurse." "You're a floor nurse who spent 11 months watching what happens when the system is wrong," he said. "That's exactly the perspective they need." She thought about what to say and decided the simplest version was the right one. "I'll think about it." He nodded. Then he did something she didn't expect. He extended his hand, not for a handshake, but with the palm upward, which was a gesture she hadn't seen in years and recognized immediately. The field medicine equivalent of a salute between equals, not rank, just recognition. She put her hand in his. "Stay in the light where they can see you," he said. "Don't let them make you invisible again." She held the handshake for a moment. "I won't," she said. He left. She stood in the empty room for a few seconds. Then she stripped the bed linens, folded them onto the cart, and went to check on her other patients. The formal outcomes came in stages over the following weeks, and they were not neat, because these things are never neat. Ellis Brandt was removed as medical director effective the day after the board's emergency session, the removal unanimous, the language in the official announcement describing a loss of confidence in institutional leadership that communicated everything clearly by saying almost nothing directly. The cooperation agreement with the IG office meant his license wasn't immediately stripped. But the adverse findings were entered into his permanent record, and the state medical board opened its own secondary review, which meant that whatever came next for him would carry this with it. He didn't work at Maplecrest again, and the building felt different. Not better automatically, not fixed, but like a space that has had a load-bearing falsehood removed and is still figuring out what to put in its place. Holt went through the credentialing committee review. It took 3 weeks. The suppressed complaints were fully restored to the record and evaluated formally by a committee that included 2 external physicians brought in precisely because internal review had failed. The findings were specific: a pattern of disregarding contradicting clinical input from nursing staff, 3 instances of medication decisions that required retrospective review, 1 case in the Okafor incident where a delay attributable to his decisions had worsened a patient outcome. His clinical privileges were not stripped. He was placed under a supervised practice framework for 6 months, required to complete a mandatory clinical communication training, and removed from his position as department chief. He was still there, still working. That was the complicated part. Lena had said she wanted normal process, and normal process had produced this. Not the clean punishment of a clear villain, but the messy, partial, imperfect accountability that real institutional systems deliver when they're functioning as intended. He had behaved badly for a long time. He was going to continue practicing medicine under conditions that were supposed to make that harder. She could have wanted something more complete, and part of her did want something more complete, and she chose to make her peace with the distance between what justice looked like in theory and what it looked like in practice. She chose that consciously, which was different from pretending the distance wasn't there. Sandra Okafor's adverse outcome report was formally restored to the official record, the internal closure by Brandt's office notated as improper, the finding reopened and reviewed by the external committee. The outcome wasn't reversed. What happened to her patient happened, and that couldn't be changed. But the record now reflected what had actually occurred and who had been responsible for what. Okafor received a formal written acknowledgement from the hospital that her complaint had been improperly handled and that the findings should have been referred externally. It was a letter, 3 paragraphs, on official stationery. She told Thill it was the most important document she'd received since her nursing license. The 2 other staff members whose complaint records had been suppressed were located and contacted. One had left medicine. One was working at a hospital in Wyoming. Both were given the same formal acknowledgement. Neither of them came back to Maplecrest, and Lena didn't expect them to. What had been taken from them wasn't fully returnable. What could be given was the record corrected, the name cleared, the official version finally matching the true version. That mattered. It wasn't enough. And it mattered. 3 weeks after Cross's discharge, Robert Fenn, in his capacity as interim director, asked Lena to come to his office. It was a different office from Brandt's. Fenn had declined to move into the director's space during the interim period, citing a preference for not making himself at home in a position he was holding temporarily. His actual office was smaller, on the 2nd floor, with a window that looked out at the main entrance and the parking lot, and beyond them the specific low skyline of Harlow, Montana, on a November morning with snow threatening. He offered her coffee, which she accepted because she'd been on shift since 5 a.m., and she was not too proud for coffee. "I want to talk about the clinical observation protocol," he said. "I heard you were putting together a working group." "I am. I'd like you to chair it." He held up a hand before she could respond. "Not permanently, not as a title or a position. Specifically to develop the protocol revision. 3 months? Maybe 4. You'd stay on the floor concurrently, reduced to half-time there so you have bandwidth for both." She held the coffee. Thought about it. "Who else is on the group?" "Priya Suresh, if she agrees, 2 of the senior nurses. I was thinking Keisha Martin, if she's interested. An external physician from Billings who has done protocol work at a comparable facility. And I'd like a patient advocate, someone from the Veterans Services Office." "The Veterans Services Office," she repeated. "This is a veterans hospital," he said. "The patients should be represented in how we build clinical process." She looked at him. Ben was 63, had been on the Maplecrest board for 11 years, had sat through meetings and reviewed reports and signed off on things that she was still working out how much he had known and what he had done with that knowledge. She didn't entirely trust him, and she thought he probably knew she didn't entirely trust him, and he'd made the offer anyway, which was either honesty or a very sophisticated version of something else. "I'll need something in writing about the scope," she said. "What the group has authority to recommend versus what goes through the medical committee versus what the board decides." "Reasonable," he said, "and I want the timeline binding, 4 months maximum. After that, my full time goes back to the floor." "Also reasonable." She looked at the window. The first few flakes of snow were coming down, not sticking yet, dissolving against the glass. "All right," she said. She went back to the floor. The thing about the day that followed and the days after that was that they looked almost exactly like the days before. Same corridors, same fluorescent lights in the east wing buzzing after 10 p.m., same elevator that was still technically under maintenance, same patients who needed someone to actually look at them rather than through them. Mr. Paulson had been discharged and readmitted twice since that first night. Complications, the nature of his condition, the kind of ongoing case that becomes familiar in the way that certain songs become familiar, recognizable, and specific, and never quite the same twice. On the morning after her meeting with Fenn, she went to his room to do vitals and found him awake and reading, which was unusual for 6:30. He looked up when she came in. "You're still here," he said. "Still here," she confirmed. He watched her with the old soldier's attention while she worked. "I heard some things," he said. "About what happened." "Hospitals are small." "Was it worth it?" he asked. And it was a real question, not rhetorical, not requiring a particular answer. She thought about Cross's hand in hers. She thought about Sandra Okafor's face in the corridor, the long exhalation, the document she called the most important thing she'd received. She thought about the protocol working group in Fenn's window and the snow that hadn't stuck yet but would. She thought about 11 months of being the person in the room that the room had decided not to see. "Yes," she said. "Not because it worked out. It would have been worth it even if it hadn't." Paulson nodded. He believed her. She could see that, in the way that old soldiers believe specific true things when they hear them. "Took you long enough to stop being invisible," he said. "I was never invisible," she said. "They just weren't looking." She made the notation in his chart and moved to the next room. The hallway was ordinary, fluorescent and slightly too warm and smelling of whatever industrial cleaner the night crew used. Somewhere down the east wing, the buzzing light flickered once and steadied. A cart moved past. Someone laughed behind a closed door, brief and genuine, the way people laugh when they're tired and something is briefly funny and the whole day has been hard. Lena Voss walked down the hall with her chart and her credentials and her sealed history that wasn't entirely sealed anymore. And she thought about the simple, impossible difficulty of being a person who knows what they're doing in a room that has decided otherwise. The cost of it, the daily specific weight of it, the thing it takes out of you to hold on to what you know to be true when everything around you is organized around making you doubt it. She thought about the nurses and the techs and the residents scattered across every hospital in every city who were in some version of that room right now. People who had flagged something and been dismissed. People who had seen something and been told they hadn't. People who were doing the work that the record didn't credit them with. Who were keeping someone alive by the quality of their attention and going home without anyone naming it. She was not their spokesperson. She was not a symbol of anything except her own specific history in her own specific building. But she understood, in a way she had not quite articulated to herself before, that what she had done in the trauma bay that night was not exceptional in the sense of being rare. The knowledge was rare. The circumstances were particular. But the act of refusing to disappear when a patient needed her, that was what thousands of people did every day in rooms where the question of who got to be visible was answered wrong over and over again, and they answered it back with their hands and their charts and their presence. She wasn't going to say this to anyone. It wasn't the kind of thing that survived being said out loud. She just carried it down the hall with her, past the buzzing light and the cart and the closed doors, past the nursing station where Priya was frowning at a monitor and Dario was looking at a chart with the expression of a person who is just starting to understand what they're looking at, past the window at the end of the east wing that looked out at Harlow, Montana on a November morning with snow finally beginning to stick. She stopped at that window for a moment. The parking lot was going white at the edges. The bench below, the one she'd seen through Cross's window, had a thin, even layer across it now, the kind that doesn't last but commits fully to its brief presence. She looked at it. Then she turned away from the window and went to do her job. Not because someone was watching, not because the record would show it, not because the people who had spent 11 months deciding she didn't matter had finally been made to understand that they were wrong, because there was a patient in the next room and they needed someone who would look at them. That was enough. It had always been enough. It had never stopped being enough.